Thank you for the opportunity to get in touch with you through this medium. Myself, Dr. Amit Chaudhary, practicing orthopedic surgeon in a small town of Rajasthan state. Today, we are here to discuss an important and a pivotal topic, which is musculoskeletal health. As an orthopedic surgeon, I would like to brief you certain points and certain tenets about musculoskeletal health. I always say a saying that life is alive only when there is a movement. Without movement, there is no life. And for the moment, your musculoskeletal health should be perfect. Musculoskeletal health plays a pivotal role to keep up mobility and dexterity in an individual, along with enhancing their ability to work and actively participate in all walks of life. Good musculoskeletal health is also crucial to maintain economic, social, and functional assets across their life courses. Physical activity plays an important role in reducing the risk of non-communicable diseases, we call it NCDs, and it can be only achieved with adequate musculoskeletal health. Impaired musculoskeletal health can lead to acute and chronic pain, causing physical limitation, proceeding in loss of participation and withdrawal from all usual social, community, and occupational activities, further decreasing the quality of life, well-being, and mental being as well. Impaired musculoskeletal health can lead to substantial personal, community, and social consequences, particularly in older people or disease people with comorbid conditions. A strong relationship between painful musculoskeletal condition, lack of physical activity, and resulting functional decline, frailty, loss of well-being, and loss of independence, as well as depressive symptoms, has been described by various epidemiological studies. An individual with arthritis and musculoskeletal disorders is sure to have lesser active than an individual without arthritis. Thus, a lack of regular physical activity emerges as the most prevalent risk factor associated with functional decline. Most importantly, impaired musculoskeletal health causing reduced physical capability like grip strength, walking speed, or chair rising or standing balance has been frequently linked to increased mortality. Thus, weak musculoskeletal health is a key component of frailty. For example, a patient with hip arthritis is sure to have limited mobility, thus making him fragile for other comorbid conditions. Like if he has diabetes, he's sure to worsen up his diabetes because he cannot move. The impact of impaired musculoskeletal health is now recognized globally with an increase in morbidity and mortality related to it. Good musculoskeletal health is crucial for maintaining an active, productive, and prolonged working life. With an increase in global retirement age, you can see President Joe Biden, he's around 80 plus. Our, bureaucrats or politicians, they're also more than 70 plus. We always accept them to be healthy and leading a good mobility. Only then they can take care of our country well. So globally, there has been a decline in retirement age. People want to work till their end of time. So maintaining good musculoskeletal health will become increasingly important for older workers, as many occupation and work-related activities are associated with musculoskeletal disorders like low back pain, shoulder disorders, knee pain, etc. Thus, it is important to identify and implement effective intervention for people and musculoskeletal conditions to remain productive at work. High-income countries observe musculoskeletal condition to be one of the major causes of work loss or abstinence from work or early retirement and loss of retirement wealth. While developing countries see muscular condition to have a major impact on livelihoods, which is rather even more important. Thus, reduced musculoskeletal health results in reduced productivity and economic loss to the society at all levels. Since musculoskeletal disorders, conditions are chronic, painful, associated with disability and social disengagement, frequently causes mental health impairments such as depression and anxiety, as well as other comorbidities. Physical and mental aspects of quality of life related to health are known to be greatly impacted in persons with multiple morbidity. Unfortunately, this impact is even greater when there is an associated musculoskeletal condition. So NCDs or non-communicable diseases are now account for most of the global burden of the disease, with musculoskeletal conditions being the leading contributor. Developed countries well recognize the transition of burden to long-term disability conditions. However, now low and middle income countries are also demonstrating the enormous future impact of musculoskeletal condition such as osteoporosis, low back pain, driven by population growth and aging. Since age remains one of the most common risk factors for musculoskeletal condition, it is estimated that by 2050, there will be 5 times as many people over 40 years living in developing countries compared to wealthy countries, according to the World Bank data given in 2011. Additionally, obesity, other important risk factor for musculoskeletal condition, is also expected to rise dramatically in the developing countries over the next coming few decades. Furthermore, increased use of motor vehicles is another factor which has reduced physical activity, but also increasing the numbers of motor vehicle accidents and resulting in furthermore musculoskeletal trauma and disorders. I was once in Amsterdam for a conference, and I was so impressed with people who are using only bicycles to go to their work. And I happened to talk to one of the bureaucrats over there, and he said that they have lowered down the economical burden of buying petrol or diesel for their vehicles, which has, in a way, given them much more budget putting on the health system. So I think this kind of adaptive measures should be taken for getting down the level of musculoskeletal disorders. Sustained and systemic urbanization in developed countries had led to sedentary behavior among the people, particularly the young ones. The rapid growth of legends of video games and social media and movie streaming, Netflix, binge watching, these seem to be the major prime contributors. This surge in sedentary behavior is not only a major risk factor for many chronic diseases, but is also a recognized as well as substantial global economic burden. Increased physical activity and optimizing exercises, as recommended by the Arthritis Research and World Health Organization, is an optimal way to improve musculoskeletal health. Evidence show that the effect of a sedentary lifestyle, examining a desk job, can be reduced by a small amount of activity in a day. A recent meta-analysis showed that utilizing the data of more than 1 million individuals concluded that 1 hour of moderate level activity daily can eliminate the increased risk of death associated with 8 hours of sitting. Thus, a moderate level of physical activity remains a key requirement for healthy and a better lifestyle. Sedentary behavior is a major contributor for obesity and type 2 diabetes. Likewise, obesity is also a major contributor to the development of osteoarthritis, and several epidemiological studies confirm the link between adiposity and joint degeneration. Evidence suggests that the increasing level of physical activity will not only increase musculoskeletal health, but also decrease the risk of suffering from obesity-related diseases such as diabetes. Nearly 2 hours a week of moderate physical activity. I'm talking about 2 hours just a week of moderate physical activity and slowly getting down to a higher level, or about 20 minutes of daily walk or a brisk walk is also recommended by WHO. These exercises elevate heart rate and are known to be associated with a lower lifetime risk of cardiovascular diseases. Apart from rendering musculoskeletal health benefits, improvement in cardiorespiratory fitness can be achieved by changing sedentary behavior to achieve a low-intensity physical activity like walking. Exercise is now widely prescribed for rehabilitation of musculoskeletal injuries, and it's also used as a preventive health measure now, which is widely investigated with guidelines around the type like frequency and duration of activity. Low back pain and neck pain can be benefited by staying active and exercising regularly. Group exercises program, weight loss programs are also propagated. To reduce the incidences of fall, balance and strength training, home hazard assessment, participation in fall prevention programs, and getting involved in activities like gardening, dancing, etc. helps. Osteoarthritis has been shown to be benefited from activities like swimming, aerobic fitness, like pilates, weight loss support, and all things can be recommended. Aging is inescapable, it's irreversible, but it can be made easier and healthier with the help of exercises. Exercises renders many benefits to the aging body, including reducing the manifestation of aging phenotype. A recent systematic review, which I was reading recently, concluded that physical exercise renders a positive impact on a muscle mass and function in healthy subjects aged 60 and above by improving muscle performance, by increasing the ratio of type 1 and type 2 muscle fibers, increasing the cross-sectional area of the type 2 muscle fibers. A European study of clinical economic aspects of osteoporosis and osteoarthritis task force recommended higher protein intake with combination with physical exercises in postmenopausal women, which are at age of osteoporosis. Physical exercises program improved strength and balance in aging women with osteoporosis. Additionally, fragility fractures or osteoporotic fractures can be decreased by following an exercise program early, at the postmenopausal age, and increases Also, the bone density and reduces inflammatory markers. Thus, having an active lifestyle from an early age and following recommendations for exercises could be beneficial for women. Our fellow gynecologists can help us in guiding the post-hysterectomy patients and the postmenopausal patient in guiding them or referring them to the physical rehabilitation program or starting the exercise program as early after menopause or after hysterectomy. Furthermore, exercise and mechanical loading also have a positive impact at the molecular, cellular, and tissue level, which is evident in many literature. Likewise, with aging, the potential for cell proliferation and number of stem progenitor cells decreases in tendons. Exercise loading can induce an increase in tendon collagen synthesis, thus increasing the tendon strength. Physical exercises and mechanical loading also have a positive role in maintaining cartilage and bone health. Moderate exercise should enhance the quality of tissue produced during the healing of injured tendons in the cases of any trauma. Surge in sedentary behavior and unhealthy diets have caused global obesity epidemic, I would say, along with sharp rise in the incidence of type 2 diabetes. Thus, further a great risk factor for cardiovascular, neurodegenerative, and musculoskeletal diseases. Obesity is an important comorbid condition of many musculoskeletal conditions and is closely related to development of OA, one of the commonest musculoskeletal health issues these days. The strategies aimed in reducing obesity in the adults will reduce the occurrence of OA definitely and can alleviate some of the pain conditions. Whenever I see my OPD patients and whenever I see that they have obesity levels are higher, I always, before prescribing any medications, I always give them certain ways to reduce weight, get them in a good obesity, below obesity level and good bone density level, which can help them in further, elevating the conditions of OA. Exercises, weight loss have definitely benefited many adults which have developed early OA conditions. Thus, combining modest weight loss with moderate exercises can provide the overall improvement in symptoms of pain and joint condition. Lack of physical exercises in childhood causes childhood obesity. We see many subcapital femoral epiphysis, CAFE, which has led to musculoskeletal decline in childhood. Thus, reducing obesity in childhood by encouraging physical activity and also reduces the development of MS diseases in the early childhood. Consumption of unhealthy diet, sedentary lifestyle has definitely contributed to obesity. So having a good diet plan taken from a physician or a dietitian will definitely help. And diet is inevitably an important part of healthy living. A 3-year follow-up recently, which I was going through, stated that 400 adults showed that the high diet in potassium from fruit and vegetable intake and reduced amount of muscle loss in adults which were like more than 65 years of age compared to the people who were not taking those diets. Dietary flavonoid intake from fruits and vegetables is also known to be positively related with good bone health. Improving the diet in OA patients has also shown a great benefits like vitamin D supplementation, calcium supplementation, and particularly protein consumption in a good moderate level, which is shown to optimize muscle, bone, functional outcomes in older people, reducing fall and fractures subsequently. Calcium and protein synergistically optimize bone health. So both kind of dietary strategies should be included for including muscle protein, calcium intake, vitamin D, and vitamin K is also an important key factors in bone health. Antioxidants, rich diet may also benefits athletes by improving tissue repair. Sarcopenia in adultery patient can be benefited by combining exercises with a dietary supplementation of whey protein and a moderate level, of course, fortified with vitamin D, increases muscle strength and muscle mass. So I think these kind of tenets which I had elaborated, there are definitely a lot more other things which my fellow colleagues will also be able to help you. I think timely watch, timely consumption of good diet, and timely exercises will definitely elevate the musculoskeletal conditions in the long run, hence increasing the productivity and living a good life, healthier life. And I said in the beginning, life is only life when there is movement. So I hope whatever things I've elaborated today will help you in some way or the other. Thank you so much. And if you have any queries, you can contact me later. Thank you so much.